Hello, good morning, guys. My name is Eric Khan Boloch. I am first year student of Bachelor of Physiotherapy at Marwadi University. My today's topic is range of motion of ankle joint, and the subject is exercise therapy 1. Today I am going to talk about range of motion measurement of ankle joint, technique, tools, clinical relevance. The presentation is made by me, Eric Khan Boloch. Let's start the basics. ROM, it means range of motion, stands for range of motion, which refers to how far a joint can move in different directions. In physiotherapy, measuring ROM, range of motion is very important. It is help us understand joint flexibility, monitor progress, and guide treatment. The ankle joint is particularly plays a crucial role in walking and posture. It is often affected in injuries, arthritis, and during post-surgery rehabilitation. Now we can go for the anatomy of ankle joint. Now let's understand the anatomy. The ankle joint involves three main bones: tibia, fibula, and talus. Movement allowed at this joint include dorsiflexion, plantar flexion, inversion, and eversion. In dorsiflexion, where the root moves upward; plantar flexion, where the root points downwards; inversion, turning the sole inward; eversion, turning it outward. Also, several ligaments and muscle help stabilize and move the ankle. Now we can go for the types of ankle joint movements. Here is a quick summary for these movements. Dorsiflexion is when the toes move up. Plantar flexion is when the toes point down. Inversion means the sole turns inward. Eversion means the sole turns outwards. Each of these movements has a normal range of motion, which can we must know to detect any abnormalities. Now we can go for the tools used for measurement. To measure a range of motion, we can use tools. The most common is goniometer, either universal or digital. The most common goniometer was. We also use inclinometers, type measures in some direct methods, and even mobile apps which are still emerging in the field. All of these tools help us measure the joint of ankle accurately. Now we can go for the patient positioning. Proper patient positioning is the key. The patient should be seated or lying down. We bend the knee at 90 degree to avoid interference from the calf muscles. Calf muscle, it means gastrocnemius. The foot should hang off the edge of plinth to allow movement, and we must stabilize the leg to avoid any compensation of cheating movements. Now we can go for the measuring dorsiflexion and plantar flexion. To measure dorsiflexion and plantar flexion, place the goniometer fulcrum and laterally malleolus. Align the stationary arm with the fibula and the moving arm with the fifth metatarsal. From the range of motion is dorsiflexion 0 to 20 degrees, and in the plantar flexion it was 0 to 50 degrees. Measuring inversion and eversion. For inversion and eversion, the fulcrum goes on the front of the ankle. Stationary arm is aligned with the tibia and moving arm with the second metatarsals. Normal range are inversion is 0 to 35 degrees, and in eversion it was 0 to 50 degrees. Now we can go for the clinical significance. Why is this important? Because ankle ROM measurement help us in diagnose problem, track rehab process, set therapy goals, and most important, prevent overload and re-injury. Common error and tips. Some common errors include not stabilizing the leg properly, misalignment of the goniometer, confusion between passive and active range of motion. Make sure clarify, and don't forget the record both sides, left and right, for comparisons. Now we can go for the conclusion. To conclude, measuring ankle range of motion accurately is essential. Even simple tools like goniometer can give reliable results. Regular monitoring leads to better outcomes, and always follow the standard techniques for the best results. Thank you.